Lola Johnson-Rosales, and this is skill set of non-sterile compounding, skill 9, reconstituting a pediatric suspension. For this lab, I'm going to be using the following materials. An additional material I'll be using is a face mask. Right now we're going through a terrible pandemic of COVID-19, so for health awareness, I do prefer to wear a face mask when I'm conducting my labs. When you're creating medications and mixing ingredients, you don't want to get any of your own germs to affect the prescription that you're making. So I have the face mask. I have my nitrile gloves. We have the 200 milligram of 5 ml oral suspension, Teachman Zithromax. This is going to be for our patient. I have a graduated cylinder for measuring the water today. And then of course I have the auxiliary labels, which is the shake well and refrigerate, for example. Then we have the graduated oral syringe that will be given with the prescription to the patient's mother or caregiver when she comes to pick up the prescription for the child. So, according to this prescription, what I also have is I have the sterile water, distilled water that we use for mixing medications. Never want to use tap water. You want to be sure that you're using the appropriate water. We have the orange flavoring. And I'm working on a surface of wax paper, and I do have additional paper towels if I need them for any unexpected spillage. So the first thing I'm going to do are following steps for this lab. I will be labeling the prescription bottle, adding any necessary auxiliary labels. I will initial the right corner of the labeled bottle, place the additional label on the Skill 9 Pediatric Suspension Reconstitution Assessment Form, dispense the medication with the oral dose spoon, and explain the storage and use of the medication, who will be the observer, who will, in this case, be the parent of the patient. So on the assessment form, I have the medication labels. Additional steps I'm doing: verifying the expiration date of the medication and determining the refrigeration expiration dates. So in this case, looking closely at the bottle, and once this has been shaken well before using, maybe kept for 10 days, discard unused portion after donning is completed. We'll be adding 15 milliliter of water to this bottle. And this, of course, is the medication bottle. Then I will give it to the patient. Gather the necessary materials as I have. I will perform the proper hand washing procedure. Don my nitrile gloves. Subtract the exact amount of off flavoring ingredients, 0.3 milliliter total of orange flavoring, from the total amount of water needed. Total amount of water needed is 15 ml, so minus 0.3 ml, that would be 14.7 ml of water that we would be adding. Then we also allow a little bit, just a little of margin of error. The graduated cylinder and proper procedures, I will be measuring the amount of sterile water needed for the full prescription. Once I've gone ahead and measured the amount of sterile water, I will then add the 0.3 ml of orange flavoring to the medication bottle. The observer will verify the correct calculations and measurements have been completed. That will be my Penn Foster College instructor. Following the printed directions from the medication bottle, as I will have. And then the observer, who will be my Penn Foster College instructor, will verify that the suspension has been mixed well. So, let me get started. I'm going to wipe down my materials with alcohol. First, I'm going to put the medication cap to the side. The only material I'm not wiping down with alcohol is the syringe because it's already pre-packaged. I'm not taking the syringe out of the package. Okay, so I'm adding 14.7 ml of the water. It does say to add 15 ml of water to the bottle, so I will be adding the 15 ml. Very slowly, I want to add the water. It's best to use a small container and add in the water so you don't put too much. So an additional, since I'm going to be adding the water like that, using a small container, I actually have this small additional medication scooper. And I would pour little amounts of water in here at a time. Which is great because right now, this is set at, happens to be 15 ml. And that's exactly the measurement that I wanted of water to go in a bottle. This is graduated here, it tells you, got 30 milliliter or 15 milliliter. I would suggest this as an additional material when you're doing this lab. Should be 15 ml of water. I'm now going to slowly pour that in here. I'm going to shake this really well. Oh, but you know what? Oh, I have to remember. This is my flavoring. The flavoring goes in a bottle too. This has been pre-measured already from when I received it from my college. So I'm going to add this to here. There we go. Now it's ready to be shaken up. Very well. Here I have to prepare Zithromax for my customer. Hello, you are the mother of Adele Wilson. Here is your daughter's prescription. There is a syringe that I've included with the medication. She will be taking 2 teaspoons or 10 ml. You will know the measurement because this syringe is exactly as the measurement is. 2 teaspoons on day 1. Then for 4 days after the first day, she used to take 3/4 teaspoonful, 3.75 ml daily for 4 days. And then you will discard the remaining. So she's taking it for a total of 5 days. Do you have any questions? Okay, how long before you throw out the medication? Yes, ma'am. So, you do want to discard it, ideally within 7 days. She's only going to be taking it for 5 days. Do you have any questions? Okay, that completes the prescription. Thank you very much, and I hope your daughter feels better.